Why is it that that wound has refused to heal? It has been there for weeks, for months, but is still there without healing. It could be that your blood sugar is bad as a diabetic patient, but it could also be a sign that you are diabetic if you are not actually diabetic. So for a diabetic patient that have wound that has refused to heal is because of your blood sugar. Once your blood sugar is not good, you will come with a lot of problem in terms of wound healing. Your wounds will not heal. Why is that? Because first of all, if your blood sugar is high, that will weaken your immune system. And once your immune system is weak, bacteria will proliferate and cause you a lot of damage. And you know that high blood sugar is like a food for bacteria. So they use it to multiply and cause you harm. And once your blood sugar is bad, thickening your blood, blood is not supposed to be very thick to allow for flow of blood. And blood is needed for wound to heal. So once your blood is too thick, that wound will not get the needed blood and the needed nutrients in order to heal. Apart from that, diabetes also damages the blood vessels. It makes it very narrow. And once the blood vessel is narrow, there won't be adequate blood supply to the wound. So it is very important that you fix your blood sugar. And I've said it here that diabetes damages the nerves. And when it damages the nerve, if you develop wound, you may not even be aware until there is superimposed infection, bacterial infection, before you actually notice. So it is very good to fix your blood sugar. And apart from the high blood sugar also interferes with the formation of muscle tissues that will help your wound to heal. And once these wounds are not producing, they are not increasing, that wound will never close. That's why you see women that have had CS and they are diabetic, for that wound to heal, it will take a lot of time because their blood sugar is not good. So if you have a wound that is not healing and your blood sugar is bad, the first thing to do is fix your blood sugar through medication, through exercise, and through diet. The medication would prefer insulin because insulin, apart from controlling your blood sugar, it helps with the wound healing because it makes the tissues, the muscles to proliferate so that the wound will close and heal. Apart from that, it's very important that that wound should be dressed by a professional, either a nurse or a doctor. Apart from that, you may need antibiotics, especially if there is bacterial infection in it, and you may need culture. So they will take small part of the wound to culture to know which bacteria and the right medication for you. So if you have wound that is not healing, it's a serious matter because some of it may lead to amputation of your legs. So you need to seek the help of a professional, especially an endocrinologist, so that he will fix your blood sugar and that wound will heal.